Okay, I guess we're ready to get started. Go ahead and get started on the meeting today. Um, this is kind of easy, but it also is important for people who don't have problems with diabetes. As you all know, the message is very similar. The science is a bit different with each of these meetings that we hold. And so we want to welcome you tonight. We have a special couple of guests who I think you'll find pretty engaging listening to their story um, of the diabetes that they have been living with and how it was improved by making some lifestyle changes. So with that said, we're going to see if anybody in the audience has any questions to start. And I don't know if we have anything else that we want to share with them, upcoming events or whatever it might be.
If you haven't signed up yet, we have the grocery store shopping tour coming up on Thursday, the 14th of November, the Winco Mohawk. So it's on the EugenePlantBasedProviders.com website. On the home page is there sign up for that if you haven't yet. I haven't heard if it's full or not yet. It's maximum of 20 people. So if you want to do that, go to livelifestylemedicine or EugenePlantBasedProviders.com on the homepage. It's on the upcoming events section, but I also have a link to it in the class newsletter that comes out every Sunday morning. All the information is there as well. But if you want to do that.
And we also want to welcome everybody who's signed in online. We've got, I don't know, 2, 4, 6, 7 people online. And our guest speaker tonight will be coming to us from online. Let's see. Anybody in the audience have anything they'd like to share? I'm just kind of delaying a couple minutes because sometimes people are a little late. We're going to start with Mary Ellen first.
Hold on. No, but for
yeah,
it online,
picks up better for the people in the room.
My third great grandson was born this morning at 8:10.
Okay. Congratulations. Okay, who's next here? Keep coming forward. Hold on a second. We're going to give you a little microphone close to you.
I wondering if you could speak up a little bit. The room really makes it hard to hear.
Go ahead.
Okay. So last week we had potluck. I did bring some of the recipes for squash and also for the pumpkin cheesecake. If anybody's interested, so one thing, share that.
Great.
And then we'll be able to talk about the class.
Perfect.
Okay.
Nice. One more.
I was just going to say that we've had a lot of diabetics in my family. So my aunt, 10 years ago or so, was told by her doctor, of course you're going to get it. It's in your family. And it's not if you get it, it's when you get it. And now reading and learning all of this stuff, and hearing all of this stuff, my aunt, who eats mostly plant-based, today is her birthday. She's 73 and has no diabetes. And her doctor's like, oh, wow. But we have all been told, oh, it's in your family. You're going to get it.
Nice.
Yeah.
Thank you for sharing that with us. As a brief introduction, there are people who have type 1 diabetes, which in days past was generally associated with being a lot younger, still is to a degree, autoimmune disorder where the pancreas not producing any insulin or enough to do the job. And then there's type 2, which your body is able to produce some insulin, but there is a resistance. The cells, the way the insulin works, it's reduced ability to allow sugar to get into the cell. As you'll see in the videos that we show later, that's oftentimes related to the amount of fat in the cells. and that leads to insulin resistance. So that's kind of a brief introduction. Tonight, you're going to be hearing from Stu Stevens and Sharon Stevens. Stu has been a type 1 diabetic. He'll tell you for how many years. He's kind of like I am, a dinosaur in that respect, a lot of years. Um, anyway, I think we can go ahead and get started now because I think everybody is going to be here in person is here. And so I'm going to introduce you. I'm going to kind of enlarge the screen a little bit by, let's see, pinning Stu and Sharon.
Should I dim the lights? Maybe?
Yeah, we could dim the lights for them.
Oh, sure.
We can see you quite well. Stu and Sharon, Sharon and Stu. It's always good to hear from you. And the class is kind of, I believe, very interested in hearing what you have to say. So I'm going to kind of give the floor to you. And let's make sure we can hear your sound okay. I'll let you know.
Is our sound on?
It sounds good.
Sounds good. Excellent. Well,
So
we're
now-
kind of in an out of the way area. We're camp hosting up at Fort Worden State Park in Washington, outside of Port Townsend. And not much Wi-Fi up here, except for in fact, you can see in the window there, they call it the Brig House. So it's a little restaurant bar that is the old brig where they would throw the soldiers in jail. You can kind of see some of the rooms in the back are the jail cells. So it's kind of fun that way. But they do have nice Wi-Fi here. So we're kind of out on the porch and it's really nice here. They got heaters. We're doing really well. So this is a half live, half Zoom class. Is that what I'm understanding?
That's exactly right. Half in the room here, more than half, and then about a third at home.
Nice. Well, so you just want us to go ahead and do our little talk?
Yeah, we'd love to hear from you. I always enjoy listening to both of you.
Great. Well, we met Charlie, gosh, 10 years ago now. Can you believe that, Charlie? Yeah.
Yeah.
And Charlie was doing kind of one of his first classes in Roseburg, Oregon. And I'm actually going to let Sharon start because she's the one that started this whole thing and drugged me along with it. And so she'll let you know kind of how we got started into this.
So I might introduce, so I'm Sharon Stewart Stephen, married for 43 years. We met at diabetes camp. I was the nurse from Nebraska, flew out 1980 to be the nurse at the camp that he had resided at for 8 years. And that was the year we met. But fast forward 2015, we had moved to Roseburg. I had accepted a job there at the VA. And one of the components of taking a new job is you might get the job, but then they make you pass the pre-employment physical. And I had come from, pretty stressful job. I knew that my health wasn't the best, even though I felt like I was fairly healthy. But I knew that I had a lot of cardiovascular risk factors because my parents, my father in particular, had lots of cardiac risk factors. So did my brother, came from, a high risk factor family. And also by then I knew I had usually high blood pressure when people took it. I had high cholesterol. I had pre-diabetes, but charged ahead and tried to pass that pre-employment physical. And at that point in time, in Roseburg, when everything depended on my job, Stu had retired a couple years before that. And they had to take my blood pressure like 9 times before they got a reading that they were willing to write down on the paper. And it was that moment that I really had an aha moment that I had always gone through our marriage thinking that I would live longer than he would. And he'll go into those details. And I suddenly became aware that maybe it was going to be me that would precede him in death. And it really shook me to the core that all these years I thought I would be the one to, survive. And I thought with all these risk factors, who was I fooling? So we saw in the newspaper an ad for this healthy lifestyle, healthy living class taught by a doctor, Dr. Charlie Ross. And I asked Stu if he would accompany me to the class. And at that point in time, you've heard my spiel. I'm just, had many opportunities prior to change our lifestyle. Felt like we were doing pretty good because I, followed like an American Heart Association healthy diet, but obviously it wasn't working for me. And I really worried about him, being that he was the one that was supposed to go, in that he had diabetes and he was logically the one that had the shorter lifespan. And so through lots of prodding and actually bribing that if he went with me, because he was not interested at all, but I said, if we go to this class, then we can go look at the fish ladder. And so he, like, through not really willingness, he accompanied me to the first class. And that's where we'll kind of take off with Stu's story of how that ended, or began, I should
Began.
say.
Mhm. So, yeah, to start with, I have had type 1 diabetes since age 12, so 1970, 71. And at that time, there was diabetes in my family. Actually, I'd lost I should say I didn't lose, but my mother had lost a sibling at age 7 in the 30s from type 1 diabetes. And at that time, insulin was around, but it hadn't been dispersed out to rural places where they were at. And my aunt died at age 7 from type 1 diabetes. And so my family knew what it was. And short story, I developed that, and we, got tested. And I do remember hearing from the country doctor talking to my parents about longevity of someone that, a juvenile that's developing type 1 diabetes. And at that time, you can go look it up right now, but the life expectancy in 1970 was about 15 to 20 years. And as a 12-year-old, I overheard that, and tough to take, but luckily I was 12 and it didn't really, 20 years was a long time when you're 12. And luckily I ended up going to the diabetes camp in Oregon, out at Gales Creek, outside of Forest Grove. And I think that really helped me kind of spur myself along, but still always in the back of my mind with the reality of not going to live a long life. And, I met a nurse at the diabetes camp, and she's the one that kind of said, maybe we could get married. And I was just like, you don't want to marry somebody that's going to die on you in 5 or 10 years, do you? And luckily she said yes. And so with that, we kind of started our lives. And then it's just like, there was no way I was going to have children, because why would I have children and not really be able to live long enough to see them go through life, go through anything, grade school, high school, any of that kind of stuff. And again, I feel lucky in that I think part of it was, people always ask me, now, how did you make it to the point where I am now? And so my first 40 years, I think part of it was I did grow up on a farm. And yes, we ate, it was a dairy farm, so we drank a lot of milk and we ate a lot of meat, but we also rounded that off. We had, we had orchards, and we had, 3 meals a day. It was very structured that way. I wasn't in town, so I couldn't just go down and get donuts at the corner store every day, like a lot of my classmates would that lived in town. And so I felt lucky that way, but I was developing over those 40 years, all of those risk factors that they talk about. So some peripheral neuropathy in my feet and in my eyes. I actually had to have some laser therapy in my eyes in the 90s, which is the predecessor to going blind. Luckily, my kidneys never really acted up, but there were just multiple things that
High blood pressure.
high
and
blood
3
pressure.
medications.
Yeah, 3 blood pressure for high blood pressure, cholesterol, high cholesterol. So they started me on ACE inhibitors, and I was on, quite a few meds to kind of maintain this. So I always felt like, well, that's the best I'm going to do. And I was pretty good at following the American Diabetes Association guidelines of really low carbohydrates and a really high, what they call protein diet, but which that means is just a lot of meat and cheese and milk. And so, yeah, I actually was in the obese category at that time. And just generally not feeling great. And so get to
Sure, sure.
2015. Yeah, we get to 2015 and Sharon's like, we're gonna go to this healthy lifestyle class that this physician is teaching. And we were both in healthcare. So I'm like, physicians don't know anything about nutrition and lifestyle. What are we gonna learn from this guy? And luckily, it was from day one that Charlie was putting up the things that he's been showing you folks, Gregor and Bernard and all of these guys that have done research and studied all the research. And we were kind of researchers. So it's just like, after that first class, we went home and started our own little studying, looking it up and reading all about it. I did know that there was no cure and still is not a cure for type 1 diabetes. But we thought, well, let's go ahead and give it a try. And so within the first 3 weeks of trying this, I'm having a really hard time. My blood sugar plummeted low, and I'm pretty good at adjusting how much I need by how much I eat and how much insulin I take. And I was like cutting back a 1 or 2 units at a time. And so my blood sugar for 48 hours, it was like 2 full days that it was just plummeting. And it was, again, we know the reasons now that that's happening, but looking at the time, I did not know the reasons it was happening. And so it was kind of odd to be doing that. And talking with Charlie and Scott later on, it's like realizing I not only had type 1 diabetes, I also had type 2, the insulin resistance type of diabetes. So the type 1 is just where you're basically on manual, you eat something and you take that much insulin to cover it. Just like your pancreas does. When you eat some, your pancreas gives you that much insulin to cover it so that your blood sugars stay at a good level. And all of a sudden, I kind of wiped out my type 2 diabetes within weeks. And I always tell people that if the people that are going to start this, you want to be aware that it's going to affect you really fast. And I have theories of my own now, like you've heard the term brittle diabetes, brittle diabetics. And to me now, what that means is that's a person that the day before had a Big Mac hamburger at McDonald's and just got a big fat load of fat. And then the next day, they can't keep up with their insulin. All of a sudden, their insulin's not working right, and they don't know why. And so the providers would say, well, you just have that brittle diabetes. It's up and down. In fact, I think everybody's kind of insulin works the same way. But it is kind of that diet regulated kind of thing. So after a few more weeks of being on this diet, and we decided like all at once, I think Charlie's probably told you his story. It's like we also, when we decided to try it, we stopped, we got all the dairy and meat out of the refrigerator, all the fat, we threw out the bottle of oil, and we started it wholeheartedly. And that's why I think it really affected us quickly, especially me. Within 3 weeks, I'm like almost passing out. If I squat down and I stand up, it's like all of a sudden, it's like my blood pressure is in the basement. And so we kind of started weaning back some of the high blood pressure pills, and Charlie was helping us out with that. And within, a month, 6 weeks, I was off all 3 of those blood pressure medications. And this was 10 years ago. And guess what? I have never gone back to them. I still have normal blood pressures at my doctor's office when I go in for my visits. My cholesterol plummeted down to, it's like crazy levels right now. Like when you look at
Crazy low.
crazy low cholesterol. And again, it's not one of those things that come and go. In fact, my endocrinologist, my diabetes specialist doctor, he's telling me, this is one of those things. It's like a pendulum. It'll kind of swing that way for a little while, but it'll kind of come back. So we'll just kind of watch this for a while. And guess what? It swung that way and it has never swung back. It has stayed good the whole time. So then within 6 months, everything, my feet, the feeling, the tingling, the pain I was having in my feet went away, have never come back.
Your eyes got better.
My eyes got better.
Lost 60 pounds.
Lost
cut
60
out a
pounds.
little bit.
Yep.
It cut out a little bit. So could you go over your feet one more time?
So again, the peripheral neuropathy with my feet was, you kind of get tingling and some pain. And I had a little stress fracture in my foot that was not healing. And within about 6 months, that all went away. So pretty miraculous change.
And you lost 60 pounds.
And we both lost, Sharon 50 and me 60 pounds. So I got down to normal BMIs. And again, I always keep going back now. It's been 10 years and everybody's like, oh, it's gonna, and it swings a little bit, but nothing like back into, obese category or anything like that. I actually retired early because I'm looking at premature death, what I would think, at any time. And again, I just was figuring my complications were going to keep going. And that was kind of what I was looking forward to is, an early death. I was lucky enough to see, we have 2 children, 2 daughters, and I got to see them graduate from middle school and then high school and then college. And now we have granddaughter. And again, in the last 10 years, life has kind of started over again. Our activity level has kind of skyrocketed. Again, right now we're camp hosting at a state park where we go around and we're walking the foothills, picking up garbage and doing all the work and activity, the weed eaters and everything. And we're pushing 70. And we're out there just doing whatever we want to do, which is absolutely amazing. And
one of the things we did, we definitely had a goal to get Stu retired early. Because we really, I planned on being a widow. I just planned that from early on, and it's just like all of a sudden we had this gift of this much longer and healthier life. And because of that, when I turned 60, that job that I was getting the pre-employment physical, I decided I'm going to take a little time off. So then I retired, and we would not have had that courage had it not. We felt so confident. By 2 years into it, we felt so confident about our health that we could take a little risk and just not, pay attention to what all the naysayers say, like you'll never get another job if you need to get one, or how are you going to do this? And so we've just been traveling in our little RV, and we travel all over, and we're able to incorporate our lifestyle in this travel lifestyle. And it keeps us active, keeps us where we just have our little way that we cook, which we can talk more about that with questions that come up, is how do we do this? How do we do it when we're traveling? This place behind us, they have 3 entrees that they're serving, but one, you can make a bowl that you can put tofu in it and basically have a healthy bowl. So we have a lot of methods that we
So
do.
this is,
Is that a question?
so while your screen is frozen there for a little bit, I'm gonna sum up a little bit. You were living your life as if you were going to die, and then at some point, you wound up taking this class that you didn't want to take, and now have wound up actually enjoying your life, and looking forward to living as opposed to worrying about dying. That's one issue. You got off of a lot of your medications, all of
them except insulin,
your
which
high
I'll
blood
always
pressure
be on
medicine.
that.
I don't know how many other
Yeah.
medicines.
Yeah, nothing
Okay,
else.
insulin, but could you share how much you were able to reduce the insulin, and also some comment about your vision? You mentioned you had some vision changes. I see you're wearing glasses, but how did that change? You mentioned your feet got improvement. So insulin and your vision.
So the insulin, again, we started cutting back the insulin. Again, I was cutting back just 1 or 2 units at a time, which would be normal for somebody with type 1 diabetes that's having low blood sugars. You would want to not have lows the next day, so you would cut it back. And in theory, I should have been cutting it back 5, 10 units at a time. And I was taking, well, I don't even remember now,
Cut
but
it down 2/3.
2/3. So I
You
cut
cut.
off 2/3 of the amount of insulin that I was taking. So I was taking a basal insulin, and I was probably taking 25 units, and then I got it down to 6, 7 units
Mhm.
a
And how much
day.
money did that save you?
Oh, boy.
Oh, yeah.
That's why we're living, that's why we were able to live on his early Social Security, and,
Little
just, we
pension
save a
and
lot of
a
money.
lot of money. Yeah. Yeah,
Okay.
that and all the medications, with those
Mhm.
being dropped, it's just like an amazing amount of savings. Yeah.
And then I told you at the start that my blood pressure was high. It's been low, 108 over 60. My pulse is reliably under 60. So I'm on no medications except vitamin B12. And Stu is on his insulin and vitamin B12.
So, what was the
Vision.
next?
Your
Oh,
feet.
my
Yeah.
vision. Yeah, my vision. Again, I've been wearing glasses, nearsighted for a long time, but I remember in Roseburg, I was going out to Costco, and the optometrist there, she had seen all my prior, my regular glasses, and as we age, your eyes get worse, and so that always gets, gets a little stronger. You got to kind of have your correction face, and she's looking at it and she's like, well, your vision actually has improved from last time. She goes, that doesn't really happen with someone your age, you know? And it's like, well, it is with me. And then I was seeing the ophthalmologist for my retinal peripheral neuropathy. Retinopathy. And we ended up in Walla Walla during the pandemic. Sharon actually went back to work at almost 65 years old. And so I was seeing, and luckily it was a 7-day Adventist kind of town. There's a college there, and he was really into plant-based. So it's like, oh, this is perfect. We'll go see him. And he saw me like 2 times in about 6 months. And then after that, he's like, I don't need to see you every 6 months, maybe a year. In fact, if you just keep going to your optometrist, and if he sees anything, he can let me know. And so that's where I'm at with my vision. It's like, and my glass, and I think yours too.
Yeah, we haven't changed.
Prescription in our glasses for 5 years.
Yeah, they're
5,
kind of,
6 years.
they're readers. They're more like for reading. but-
Yeah.
Which normally happens in your
Right.
60s, that you need something to help reading.
Mhm.
We also travel, I mentioned travel. We go to Mexico. This will be the 8th winter we'll spend in Mexico. So, we're not feeling like we need to spend, keep a short leash with our doctors. And so many people we're starting to meet in our age category, they're afraid to travel. They're afraid to be mobile because they don't want to get too far from their doctors and the hospital. And we're like, oh, we're going to Mexico in January, and then we're going to go to Puerto Rico in March. And
Next
we're going to
summer,
do a
we're
big
going-
trip in
Next summer, we're going to Europe for a couple months, and now have no qualms about traveling. Yeah. The other nice thing with diabetes, type 1 diabetes and type 2 also is now I have what they call a continuous glucose monitor. So you wear this thing, and every 5 minutes it gives you a blood glucose level. And then I just started an insulin pump, which I had one like 20 years ago, but just for a short time. But I have another one now that is tied right in with the continuous glucose monitor. And so I'm getting constant feedback, and all of those things that we were talking about. And Charlie has talked about how the fat level seems to be the key. And I know Bernard has done studies that has proved that, but on myself, it's really amazing because I can see it day to day. If I eat something that has a little more fat in it than I normally would take, I will see my insulin resistance go up. I'll have to take, or my pump will have to give me a little more insulin. And then when I'm off that, it comes right back down. So it's like, it's instant feedback on all the things that we've been doing. And it's just like, yeah, it's not that I'm guessing that it does that. I actually see it do that on a day-to-day basis. Really impressive.
I'm not sure what your demographics are in your class, but this often comes up. Like Stu and I started 10 years ago. It'd be 10 years ago, February 17th, so it's not quite 10 years. But we started at the same time, and I had lots of great results with, no pre-diabetes anymore, normal blood pressure. But weight-wise, his weight within 6 months, he lost all his excess weight, just down 60 pounds, down to his normal BMI. It was down to like 24 at one point in time of BMI. And for me, it didn't happen that fast. For me, I was doing everything he was doing, but like 2 years out, I'm still like not really losing weight quite as fast. I still have excess weight. I've lost maybe initially 30, 35 pounds. But what I ended up doing at 2 years was trying to kind of implement a stricter what's called SOS free, which is salt, oil, and sugar. And Stu was always being really careful with salt, but we went on just complete SOS free. And then that plus regular exercise helped me get the rest of the way where I was able to get down into my normal BMI. So I was, I worked on that, thinking that was a health indicator. The first time, after one of the things about women, I think the first time I went to my doctor, the first time I go in with like an absolute normal BMI, she starts to counsel me on like an eating disorder and maybe, and I'm thinking, I just want to like, yay, I worked on this really hard. It's like my first visit. I got my old records from my 30s and my 40s from my nurse practitioner. And even though she never talked to me about my weight, her first sentence was always like, 40-year-old obese female. Not once did she ever address weight during that time, even though that's what she documented. So, that was something, it wasn't the reason we did this, but it was just one of those health indicators that we thought, besides not having high blood pressure, not having high cholesterol anymore, not having pre-diabetes, it would be nice to be in a normal weight category. But it was slower for women than men.
So it cut out a little when you were talking. So you went from, you lost about 30, 35 pounds, then it kind of plateaued, and then you went to SOS, salt, oil, and sugar-free type of dietary choices. And you were able to lose how much?
Yeah, down at a point where I
About-
lost a total of 60 pounds.
Both of us. A piece. Yeah.
We always say a small
we didn't quite
child.
hear the total again.
We each lost 60 pounds, a total of a small child,
Oh,
a
me and
small
both.
adult.
Okay. Great. Congratulations. Are there any questions from the audience here, here locally or online?
We should fall closer to the computer.
I must say, for myself, having been doing this for a number of years, it's pretty inspiring to me to listen to you two and follow you throughout the years. It does my heart good and makes me want to teach another class, basically, whenever I hear you both speak. So thank you for being willing to share. And you don't only do this with us. I think you do this at diabetic camps and other kind of
Mhm.
Yep.
activities in your life.
Yeah, every year we go back to where we met and we plant the garden. We did that again on June 1st.
Every
So
summer.
yeah, every summer we go on volunteer day and our job is we plant the garden so the kids get to see a garden. The cooks can use the fresh produce and herbs out of the garden.
Just want them to see what real food looks like. They can, it's right by the swimming pool. So they see it growing and it's like, yep, that's what you need to be eating. Especially these kids, type 1 diabetes, yeah.
That's great. Okay, so let's see if we have any questions for these two. Anybody have any thoughts or?
Here too.
To me, for both of you. So we're going to go ahead and share a few videos. The video is kind of cutting out a little bit. It's kind of freezing up a little bit on you. So
Sorry about that.
well, it's not your fault. The
Yeah.
same thing's happening with us. It could be
Yeah.
our internet connection here that could be doing it. But we got in a good amount what I was hoping for anyway.
Good. Always happen to talk with your classes, Charlie. Say hi to Christine for us.
We will do that, and we want to make sure there's no one online. I'm just looking online to see that there are no hands up. Okay. All right, you two.
All right,
Thanks
thanks.
again. Thank you.
Mhm.
Okay, there's some clapping for you. Go ahead.
Yeah, I just thought I would, if there's any general questions, I just also wanted to kind of explain if there's any questions about the different types, type 1 versus type 2, pre-diabetes. Does anyone have any questions about that, or want more definitions on the differences before I kind of talk about insulin resistance, which Stu referred to there, which is the key for type 2 diabetes, and also plays a big part in type 1 diabetes, and I can explain that. So any questions about what type 1 is versus type 2? You guys kind of understand that already? Yeah.
What,
Type 1.5. Yeah.
what's that?
Yeah. So type 1.5 is, we originally thought it was type 2 diabetes caused by insulin resistance, and then there could be different pathways. So you could either you've burned out your beta cells that make the insulin in the pancreas. They burned out so much that they're not making any more insulin. And so then you essentially become insulin dependent. And so no matter what you do with the diet and lifestyle, you're still going to need insulin, just like someone with type 1 diabetes. So it could be caused by just, sometimes things like drinking too much alcohol that kind of burns out your pancreas, or you've just had type 2 for so long and such bad insulin resistance for so long that your beta cells aren't making insulin anymore. Or it can also be autoimmune, where your own immune system attacks your beta cells that make insulin in the pancreas and essentially become type 1, just like someone that we used to call juvenile onset diabetes was, like Stu had when he was 12 years old. His own immune system attacked his beta cells that make insulin in his pancreas, and then doesn't make any insulin, so I had to reject it. And so what we call another name for type 1.5 is LADA, latent autoimmune diabetes in adults. That's what it stands for. But it can essentially happen whether you have the antibodies or not. Usually people with type 1.5 will check for there's a lot of ins and outs with insulin, and still, like, you're someone with type 2, you change their diet and lifestyle. Then someone with the type 1.5, or this like type 1, you're just gonna, you can still improve your health. And so that's but I want to talk resistance. So pretty much the sole cause of type 2 diabetes, and I'll do a little demonstration. So to understand that even people with type 1 can get insulin resistance. And so we used to think that, going back, we used to think that it was mostly the high blood sugars that were causing all the complications. So the retinopathy in the eyes, and nephropathy in the kidneys, and the peripheral neuropathy in the feet, and higher risk of heart attacks and strokes, and all the bad stuff that happens with infections, and all the bad stuff that happens with people with diabetes. We thought it had to do with just having high blood sugar. So if we could just get their blood sugars normal, then maybe we wouldn't have any of those complications. And I was really at the forefront, because this is back in 2000 to 2008, really a specialist in diabetes, and I would take patients, and really the thought was, yeah, let's get their blood sugars normal so they won't have all those complications. And so we were really aggressive with insulin and all the medications. There's a lot more medications now than back in 2005 to 2008. But then thought, okay, this will be good. And then there were some studies that came out that got published in 2008. And I actually was at the American Diabetes Association conference in San Francisco in 2008 when they released the results of those studies. And those studies actually got stopped early because they were actually killing people. And what it ended up being was the people that were treated the most aggressively were the ones that were dying sooner. And so it didn't really make sense. We're like, what's going on? And so it was really kind of a thought where we had to really kind of figure out, well, what are we doing wrong here? And so now we know it's not just the high blood sugars, because you get the blood sugars normal, you think you would be like someone without diabetes and have the complications. But that's not what ended up happening. And what we now know, fast forward, is it's the insulin resistance that's really causing most of the damage to the eyes and the nerves and the blood vessels, and all the bad stuff that happens is really being caused by the insulin resistance. And so it's really important to reverse the insulin resistance, because what's great was, the good news is, if you can reverse the insulin resistance, you can reverse prediabetes, you can reverse type 2 diabetes. You can't reverse type 1, 1.5, but you can, get them on much less insulin, and then you can actually reverse all those complications. You can prevent the heart attacks and the strokes and the neuropathy and the retinopathy, and all those complications I mentioned. And so without further ado, I want to explain what insulin resistance is. And so I used to make everyone some stuff when I used to do this classes before, but probably not necessary. But I wanted to have everybody pretend that this room is the inside of a muscle cell. And so we have different parts where we have fats, and we can store fat in certain places. And like we all think about in your body, the places that were designed to store fat are inside, like, is our subcutaneous tissue. So let's just save it for our calories to burn later, right? So that's kind of where we're supposed to be storing fat. But it ends up that there's certain places that there's a genetic predisposition, but some people store fat in places that are not designed to store fat. And that's actually what insulin resistance is. So I'm going to give you some examples. So this could be the inside of a muscle cell, or inside of a liver cell, or inside of a cell in the pancreas. Kind of just think of it that way. But we'll just for this example, we'll talk about this is the inside of a muscle cell. And let's pretend that the kitchen back there, that's the blood flow in the blood vessels out there. Okay, so the kitchen is the blood going by really fast out there. And then let's name a few things inside this room. And so did everyone remember taking like biology in high school or whatever, cell biology, and all the different structures in a cell? You guys kind of have memory of that. And so let's pretend that right here, this table where Charlie is, this is the furnace, the powerhouse of the cell, the mitochondria, right? You guys remember the mitochondria? So the mitochondria actually think of it as the furnace. So it takes in sugar, it takes in fat. It can actually use that as fuel to produce heat if it's a furnace, or produce ATP, which is what we use for energy, is ATP. But so this is the furnace, and so this furnace actually gets to decide what it's going to burn and how much, and produces all the energy. So remember that, and then the blood flows out there. So first, I'm going to kind of give you an example of what happens in normal physiology, what's supposed to happen. So inside this cell, we can pretend you guys are sugar molecules and fat molecules. So you can pick which one you want. If you want to be a sugar molecule or a fat molecule, okay? And so all of you are sugar and fat molecules, and mostly there's sugar molecules in here, and some fat molecules. So the furnace can burn either of you to make energy. So that's how we do it. And so let's just say this is normal physiology. So let's say, okay, we've burned up quite a bit in here, and so we need some more fuel. The fat cells can come from the bloodstream in without an invitation. Just come on in. They can come in as often as they want. They have no restriction. They can just kind of filter their way in. And so what needs an invitation can't get in here without insulin, right? And there's a door out there, which is the door that lets the sugar come inside, have an invitation to be unlocked. And the mitochondria gets to decide if the sugar gets to come in or not, okay? And so there's only a little bit of fat in here, and say you're exercising, you're burning a lot of energy with your muscle cells, and mitochondria is saying, hey, gosh, there's not that much fat in here. There's not much sugar in here. I need some more sugar. And so then so happens you eat some food and your blood sugar out there in the hallway starts to go up. Okay. It's coming up. And so then more insulin gets secreted out into from your pancreas into the bloodstream because the sugar, it detects that there's more sugar out in the bloodstream. And so then the insulin then comes and knocks on the door back there. Knock, knock, knock. Hey, mitochondria, hey, we got a lot of sugar out here in the bloodstream. Can we come in? And the mitochondria says, yeah, actually you can come in because I have a little bit of fat in here, but not all that much. So yeah, come on in. So the door opens, the sugar comes in, gets burned for energy. That's what's normally supposed to happen. But what happens with insulin resistance is there's a ton of fat starts accumulating in here. You remember how the fat doesn't have to have an invitation, right? So you eat a bacon double cheeseburger, and a milkshake, and some donuts, and all the standard American fare. There's a lot of fat in there. Especially the worst of the fats are the animal fats. The saturated animal fat causes lots of inflammatory ceramides and all kinds of inflammatory things to happen inside the cell. So that fat comes in here. Now there's, let's just say, almost all of you in here are fat cells, and there's a little bit of sugar, but not very much. And so now same thing happens. So there's tons of fat in here. And again, this mitochondria can burn fat, can do it. But what happens then is now you have a lot of sugar out in the bloodstream out there, just like in the normal scenario. You eat some more food, so you got lots of fat and sugar. It's going up and up and up in your bloodstream. And so now the insulin comes, knocks on the door. Hey, mitochondria, we got a lot of sugar out here. Can we come in? And the mitochondria, what does it say? It says, no, no, you can't come in because I got tons of fat in here I'm going to burn up first. So I got to burn up that fat before I let you in. And so then the blood sugar keeps going up and up and up in the bloodstream. It's not getting in here because there's all this fat in here. So then luckily you switch to a whole food plant-based diet and you stop eating all that extra fat, especially that saturated animal fat. And then the mitochondria eventually goes through all of this fat, burns it all up, and then you go back to the normal situation. Hey, yeah, we don't have very much sugar in here now. There's only just a little bit of fat, so yeah, come on in, sugar. And it starts to actually work. And so like Stu was saying, how when he had a lot of fat, he would have to use a lot more insulin because even though this is one example of one muscle cell, you can kind of overpower it somewhat with more and more insulin. So you hear about people with type 2 diabetes. I have patients that are, even just the regular insulin isn't enough anymore. They have to be on U300, U500 insulin, which is the 5 times more stronger insulin. So you can kind of overpower the insulin resistance somewhat with more and more and more insulin. So it's almost like the insulin's out there banging on the door and breaking it down, essentially. It's not perfectly accurate, but that's kind of what's happening essentially, because with enough insulin, you can kind of overpower the insulin resistance somewhat. You still have the insulin resistance, but you can kind of drive that blood sugar down somewhat with just more and more and more insulin, which is not a good sign. That's why, when Stu was probably on maybe 100 units of insulin a day, and now he's on like 20, 25, because his insulin sensitivity went through the roof and his insulin resistance went way down. And so that's your goal when you have type 1 or even type 2 diabetes, is to have high insulin sensitivity and low insulin resistance. So just like the rest of us, the normal physiologic insulin is about 20 to 30-ish units a day is probably what your pancreas is kicking out if you're a normal person without any insulin resistance or diabetes. That's what would get produced or get needed to keep your blood sugars in check. So any questions about what insulin resistance is? That's actually the best way to describe what insulin resistance is. And so that's why it is so important to get rid of that insulin resistance, because again, that's what we think is causing almost all of the complications with type 2 diabetes. So getting rid of that insulin resistance is so important. And that's one of the things about like keto diets, for example. I always want to mention what I call the keto caveat is actually if you go on a ketogenic diet, high animal fat, it's like you're thinking, well, gosh, how come when someone goes on a high fat animal fat diet, they need less insulin, their blood sugars drop down, all their numbers look better? How does that work then? Well, because they're actually hiding the insulin resistance. And by that, what that is basically the insulin resistance is worse, but your blood sugars are down because you're not eating hardly any carbohydrates. So there's hardly any sugar out in that bloodstream anymore, just enough to function. But you're because and there's tons of fat in here because of all that saturated animal fat that you're eating. But because your sugars are lower and stable out there, there's not as much that's trying to get in. And so because you got all the fat in here to burn for energy, and that's why they go into ketosis, because the byproduct of fat metabolism is ketones. And so the mitochondria is just burning up lots of fat, producing ketones, and the ketones can fuel your brain. So you can stay in ketosis for a period of time, but it's a sick state. It's a state for emergency if you're starving or something like that. So you keep your brain alive. But that's why people that will have lower blood sugars, things will look better on paper when they go on a ketogenic type of diet. But it's a false sense of security, because if you gave that person what we call a glucose tolerance test, gave them a bunch of sugar, their sugar would fly through the roof because it can't get in because they have the insulin resistance, right? And so that's a good way to describe that. And it's really important to have that high insulin sensitivity and get rid of that insulin resistance. So the people on these low carb diets, and we do like 5-year studies, they actually have increased risk of heart attacks and strokes and worse outcomes in the long term. They might have better numbers in the short term for a few months, but in the long term, they're compromising their health. So, any questions about insulin resistance or even low carb or any of that kind of stuff? Or anything you want to include or add, Charlie?
No, we'll play a couple videos I want to share after, but I want to make sure no one has any questions. We're looking online and we're looking in the room.
I apologize for checking in late tonight, but I have a family member on the East Coast that is struggling with type 2 diabetes. And when you're talking and with your bank of knowledge and so on, if I were to encourage this person to go to a physician resource that would focus on similar to what you're bringing up, how would they approach that? What would you look for as far as knowing which physician might have that kind of expertise?
Well, I would just start with someone with diabetes. Number one is you need to be in communication with your provider, because if you're going to switch a big diet change like to a whole food plant-based diet, you want to be in contact with your provider, because you might have to have your insulin decreased if you're on insulin. Some of your other diabetes medications, you could actually get too low blood sugar, kind of like Stu was talking about, if you're not careful. So, but as far as the book I'd recommend, would be Mastering Diabetes. It's on the class website, lifestylemedicine.com, under the book section. So it's Cyrus Kambata and Robbie Barber. Really good book called Mastering Diabetes. That's what I recommend to my patients.
For some reason, the audio I'm having a struggle with. What's the name of that book again? I'd like to write that down.
Mastering Diabetes.
Okay, Mastering Diabetes. All right. Thank
It's
you.
on the website. It's
On the website?
Yes.
Okay.
I mean, not the whole book, but the
The
title.
link to it. What, you had a question about mitochondria?
Now we're back in the room again.
I just wondered, the mitochondria doesn't really know what it should be consuming or what it should interact with. So whether it's glucose or what's the other one?
Or fat.
The fats.
Mhm.
Is the mitochondria indiscriminate, or does can it say, can it determine that it wants to eat one or the other?
Well, I think it prefers sugar because it's less metabolically costly, where it takes more energy to burn fat for energy than it does to burn sugar. So sugar is the preference for the body, and especially for the brain. So the brain wants sugar. The brain can't use fat. for energy, but it can use ketones, and so the mitochondria burns fat and produces ketones, and then the brain can use ketones for energy too. Yeah.
One more thing online is if you have questions also and you have trouble finding, feel free to send us an email or something, and with your phone number, we can give you a call and make sure you get the information you need. Okay,
Thank
we
you.
want to, you're welcome. We want to share a video with you. And I think I have the share on here. And can any of you guess, after listening to Stu and Sharon and listening to Scott and thinking about all this, what might be talked about in plant-based diet recognized by a diabetes association as to what they might be recommending or what they've been recommending? Let's take a look at the video and see what it has to say. We can close the lights, perhaps.
Hey, Charlie, we're not hearing any audio online.
Diets section. They acknowledge strictly plant-based diets. Plant-based diets because the intention to improve body weight, the concept of mental definition or regimen that encourages whole.
Can you hear that online now?
Not here. Can't hear
No.
it.
All right, well, we'll have to have you play the, whatever it is, we'll share the video with you after the class.
It's having trouble sharing the video.
Okay. All right, well, that's what makes life interesting sometimes, right? All right, here we go. So in terms of playing it, now that I've stopped it, I can't get it to play again. All right, that's good enough for that video. Let's see if the next video is gonna work. I'm just trying to search around to figure out how to get this stopped. And we'll stop it. Okay. And let's try one more share time. And we're gonna come back here. And let's go on the best diet for diabetes. You know what it is.
Of course, there are different scoring systems for quality. name for a simple concept. It's just the calorie. So so like on a scale of 1 to 10, our diet is a 1. You can split people up based on how they score. Show how the higher you score, the better your metabolic markers when it comes to diet. Beta cell dysfunction as you eat more and more plant-based. And the highest group was only scoring about 30. Less than a third of their diet was whole plant food, but better than the lowest, which was down around the standard American diet. It made a cardiovascular mortality. It's not just prevent. On the plant-based diet. People could eat as much as they want. One of the benefits. The emphasis is on food quality rather than quantity. Even after controlling for the greater abdominal fat loss in the plant-based group, they still want to. Of course,
They do it, but those that pretty much stuck to the healthier diet drop their A1C levels 0.9%, which is what you get taking the leading diabetes drug, but of course only with good side effects. Yeah, but would it work in an underserved population? The impact of a plant-based diet support program on mitigating type 2 diabetes in San Bernardino, the poorest city of its size in California. A randomized controlled trial, but not of a plant-based diet itself, as the title suggests, but of just an education program telling people about the benefits of a plant-based diet for diabetes, and then it was up to them. And still got a significant improvement in blood sugar control. Here are the numbers. Got a little better in the control group, but way better in the plant-based instruction and support group. And more plant-based diets are not just effective in the prevention and management of diabetes, but also its complications. Check this out. One of the most devastating complications of diabetes is kidney failure. This shows the decline in kidney function in 8 diabetics in the 1 or 2 years before switching their diets. They all showed this steady, inexorable decline on a fast track to complete kidney failure and dialysis. But then they switched to a special supplemented vegan diet, and their kidney decline was stopped in its tracks. Imagine if they had switched a year or 2 earlier. Most diabetics don't actually end up on dialysis, though, because they die first. Cardiovascular disease is the major cause of premature mortality among diabetics. That's why plant-based diets are perfect. There's a general scientific consensus that the elements of a whole food plant-based diet, legumes, whole grains, fruits, vegetables, and nuts with limited or no intake of processed foods and animal products, are highly beneficial cardiovascular disease, along with obesity, high blood pressure, lowering inflammation, and we can throw cancer into the mix too, our number 2 killer. The bottom line is that the case for using a plant-based diet to reduce the burden of diabetes and improve overall health has never been stronger.
Wow. So turn the lights on for a second, and let's have just a brief little discussion. From those of you who are new you think about this, there are 2 studies in the world literature that demonstrate reversal of heart disease. Do you know those 2 studies? The one by California, one by Caldwell Esselstyn at the Cleveland Clinic. Only 2 studies in the whole of world literature have shown unclogging of the coronary arteries. So if you were diabetic, what's your number 1 cause of death? Is it going to be taking too much insulin, or is it going to be heart attack, heart disease? Could be either one, but I'm here to tell you it's generally heart disease. So what would you want to do in terms of what you would choose to eat if you were a diabetic and you have this information? Now, I must say, if this were the first time I heard this, I might be pretty skeptical. So I would want to go to the resources and try to prove this to myself, that this is just not fake news that we're talking about here, that this is a matter of life and death, literally, in Stu Stevens's case, and not only in his case, but in many other cases. And so the purpose of this class, in my mind, is for you to understand the benefits of transitioning your diet and those you love as best as possible to more whole plant food. Foods is grown in nature. Does everybody get that? Otherwise, you wouldn't be in the class. But some of you are new. I see a new face here, and we love to see new faces, especially young new faces. And so we want to try to give you the kind of flavor as to what this is all about, and that we share the science, and then you make the decisions as to whether you choose to do anything about this. And our goal is to share as much of this science by doing week after week, providing free information, sharing resources like at the library that's back there. There's a whole bunch of books Elizabeth can show you through. Some people don't like books. There are internet resources. There's the Live Lifestyle Medicine site that Scott's maintaining so well. So much information on it. And so now we're seeing if there are any questions from in the room or online. Any thoughts from anybody? Don't really mean to silence you, so we. What are the thoughts about artificial sugars? So I usually, when someone asks me a question like that, I say, what are your thoughts about that? What's your best guess? What do you think? You know, you're absolutely right. They're not. That's what my thoughts are based upon the studies. Now, does that mean it? You know, again, I'm not a policeman. I don't give tickets. Sharing the science. Those people who are eating those usually are more overweight and are not as healthy. They are not a health promoting food. They may be something that makes you feel good for a short period of time, but the health promoting foods are the ones that are grown in nature, that you can pick off the tree, pull out of the ground, harvest the seeds or whatever it is, the oats, the other. Those are really healthy choices. And, you know, even the artificial fake meats and dairy products and stuff like that, they're not really the healthiest choices. They may help you transition from what you're so used to into a healthier kind of aspect. So if you were to use you know, if you were to go from soda pop to a tea with a little artificial sweetener, I would say that's probably a good transition step. But then ultimately you may go to the tea by itself. It's a good question. It's one that most everybody who is transitioning struggles with a bit. And so what do we recommend as sweeteners? Date sugar comes to my mind. That's dates that are just
Ground
chopped up and dehydrated.
It's ground up dates, yeah.
Just ground up dates winds up to be a really good sweetener. If you want to do smoothies, just do the whole date, like 2, 3, or 4 dates in a handful of greens, a handful of fruit, a handful of water or a plant-based milk, a little flax, maybe a little oatmeal or a few white beans. And if you don't like it savory, dump in a few dates and make a smoothie. It's a healthy treat. Yes, go ahead.
I think it's important to remember that the salt is oil is because they're drugs and we're addicted to them.
It's an excellent point you make. It's an excellent point. We all love, I am telling you, I've been doing this 13 years. There are times when in the afternoon, I had this huge breakfast, but the afternoon, those peanuts start calling my name. The peanuts that have a little salt on them, not the peanuts that are salted, but the peanuts have a little salt. And so I'm very careful to have just a very few of those, to satisfy my craving for that salt. I don't add salt to anything else in my life, but I don't want to give you all my secrets, but that's one of them. What a from anybody. We have one more video that I'll play if we don't have any, but I would rather have people share their questions and their thoughts. Okay.
I was just in Orlando at the Lifestyle Medicine Convention conference, and they're moving from using whole plant-based foods like we do to being plant dominant. And it's to move us in that direction.
Yes.
Because we're so used to meat, potatoes, gravy.
So did you hear that online? I hope you did.
No.
And the rest of the people in the room, changing from plant-based to plant-dominant. Yeah, and so whatever terminology works for you is fine. This is, eating foods is kind of like on a spectrum. You have like totally all plant foods, all grown in nature, all unprocessed. That's one way to eat. Then on the other end of the spectrum, you have totally all animal products. And by the way, what is it that makes you think that eating all animal products is what we were meant to do, that's our fuel source? Because if you look at our teeth, what are they more like? Are they more like an elephant or gorilla's teeth, or are they more like the lion and tiger that rips the meat off of its and eats it raw with those sharp, jagged teeth? And there's another concept here. The length of our intestine, it's very long. It twists and twirls and goes on for many, many feet. I think it's close to 30. It's a long way. You know why it's that long? Evolution kind of pushed us along toward eating plants. It allows us, with those long digestive tracts, to absorb the minerals and vitamins, as opposed to needing a short tract, which the meat eaters were meant to. So when you think about this spectrum of all plants to all animals, you may be somewhere in the middle of that. You may be tending more toward the animal, more toward the plant. Just one more thought about what you might be thinking about here. as to what you choose to do, whether you want to be on the middle more toward animal or the middle more toward plant, because you're trying to be moderate here. You think about your microbiome, whatever that is. The microbiome, it's all those tiny millions and trillions of bacteria in your large colon. We used to think the large colon was just sucking water out before you had stool. But we know now that you populate your large colon with bacteria. These bacteria are in a symbiotic relationship with you. If you feed them what they want, the good ones, they'll feed you back chemicals like butyrate, anti-inflammatory, serotonin, antidepressant, anti-anxiety, chemicals. If you starve them, they are not going to be feeding you those. If you starve those good bacteria, you will be promoting the growth of bacteroides, which will be feeding you back trimethylamine, which gets converted in your body to trimethylamine anhydride, which is inflammatory and pushes the bad cholesterol into your arteries, leading to plaque formation and heart trouble. So it'll be your choice. But how do you know that? I'll bet you there isn't any one of us who went to school and learned this. Yes, I didn't. I learned about it by reading the books and by listening to Greger and listening to Michael Clapper and listening to John McDougall and Neil Barnard and who else? Esselstyn and Ornish, and you know, the list is a long list. This is not one person who says, hey, your blood type should determine what you eat. I had that note this week from someone that, you know, I got blood type O, and so I should be eating this, that, or the other thing. That is not the kind of people that we're getting the information. Or the Gundries types who say lectins and beans are bad for you, or beans are bad because they have lectins, denying the fact that those lectins get destroyed when you cook beans. I don't think there are any one of us who eats raw beans in this world. So be careful of who you listen to advice, your advice. I'm having way too much fun here. Is anybody convinced that doing plant-based is healthy? Go ahead.
So, been pretty committed to a plant-based diet for a long time. I've been drawn along on the ride. My version would be have a green, some fries, and beer. Kind of the way I'm a pastor and find myself in situations where the expectation was to respond by whatever's in front of me. About 2 months ago, I just decided I'm not doing it. I'm gonna do what I believe is actually true. I believed it all, I just didn't do it.
Yeah.
And so I started doing it, and I guess my encouragement to anyone here who's contemplating it, you know, it hasn't solved every problem perhaps that I'd like to see solved, that have a cough I'd like to solve. However, some fun things have happened. My wife was cutting my hair the other day, and she says, "You have black hair again."
Wow.
Yeah. And so I've lost a lot of weight. I went from sleeping 5 hours to 7 hours consistently. A lot of other things have just, I think my disposition has improved. That's what my family said.
That's important.
My skin, in a lot of ways, has cleared up. There's been a lot of really good things that have happened, and I just expect more to come. So the story's not over, but I guess there's like a lot of fun things However, there is a price to pay, and you gotta just make up your mind. This is what I'm going to do, and I'm going to do it because it's the right thing to do. This is what I actually believe.
Wow,
You can do it.
hearing that. Very nice. Anybody else?
You're gonna pay a price no matter what you do. If you're all meat and all that, and you pay a price, it's gonna be way more expensive than the price you're paying for eating vegetables.
Beans, fruit and vegetables a lot less expensive. It's like it's
At the price of you could be spending less money on healthcare and medications and all that by spending maybe a little more investment in the food, which eating healthy is actually, if you're eating it the right way, healthy, it's actually cheaper. If you buy a lot of processed vegan food, go out to eat all the time, then it's expensive. But if you're eating potatoes, buy your beans in bulk, your grains in bulk, buy produce that's in season, all those types of things, that's actually cheaper. It's been proven out to be a cheaper way to eat. But the other thing too, people will say, well, the drive-through, the dollar menu is not a dollar menu anymore. But it's still that we shouldn't be asking, why is healthier food more expensive than fast food? It's like, well, because you're paying a price on both ends. If we subsidize, basically we subsidize the food industry so that they can produce dollar food, chicken nuggets and all those things. The reason those things are so cheap is because we subsidize those things, and so they make them cheap. But we're paying. We might be saving a little bit of money there, but then you're going to be paying for it in healthcare, and that's why we spend the most on healthcare of any developed country in the world.
So before we get into what next week is going to be, I want to give a follow-up. Is it last week that Dr. Linsmeyer gave her talk
Social connection.
on social connection? She recommended we read the book together by Vivek. What is it?
Vivek Murthy.
Vivek Murthy. And I just finished it today. And Lonely book. I really would encourage you to read the book because there are just so many connections that you will find in reading through that will help you potentially reconnect. And by attending the classes here, we're kind of have formed our own little tribe of connection. And so anyway, we're really grateful for all of those of you who show up. And I think you'll all find benefit in it. And I'm grateful for Dr. Linsmeyer for bringing that up and sharing that class with us. So,
And what's the name of that book again, please?
Together.
Together.
By Vivek
Thank you.
Murthy, Murthy. He was a prior Surgeon General. Next week.
That's stress reduction. And you want to say something about it? Managing stress, yeah.
How stress can be good for you. And so it's really managing stress. Stress is a very complex, both internal and external management. Think of stress as being something that happens outside of us. I'm going to talk more about how we stress ourselves and how we might stop doing.
That's great. Okay, so we have come to the end of this session. We'll stay around for a little longer if anybody has any questions in the room. And for those of you who are online, thank you for coming. And we'll see some of you maybe on Tuesday night.
Thank you.
You're very welcome.
Thank you.
See, I gotta end this. Huh? Ed, thank you so much.